We are here talking kidney filtration. And what exactly does that mean? There are 4 major elimination pathways in the body: the kidneys, the colon, the lungs, and the skin. When the kidneys become backed up, this is when you may see some rashes or some skin irritations or boils or different things coming out in the skin. So they all work together. We are made of trillions of cells and 2 fluids. Those 2 fluids are blood, which feeds everything throughout the body, and lymph, which cleans everything. It's essentially the sewer system. All of those trillions of cells have waste. And where does that waste go? It goes into the lymph system, which then transports it to the kidneys, and the kidneys excrete it out. The liver is also filtering our blood and impurities from the body and sends the kidneys those impurities. So they're doing a lot of detoxing and a lot of work of taking on waste from the body and excreting it out. Now it's important that are they actually open and filtering out these wastes? Because if they're not, it's recycling it back into the system. And how do we determine if our kidneys are filtering properly? Glass jar, and we pee in it. And the guidelines are approximately 12 hours fasted, 7 p.m., 8 p.m., stop eating or drinking, and then approximately 7 or 8 a.m. the next morning. First morning pee you want in the glass jar, clean, clear. Yes, there is a label, but you can see for the majority. Lid, don't want any messes. Going to let it sit nice and still for about 2 hours. Going to take a picture from the side and then one from underneath. This is going to give some insight as to how those kidneys are functioning, if they are actually eliminating the ash and byproduct from the body. And we're going to be able to see that in the jar. If they aren't eliminating and they're not open, then we want to make sure that we're supporting them before we move forward with doing any other things with the body, because ultimately we want to make sure those elimination pathways are open, because as we start to move toxins out, if they have no place to go, it's going to create issues. So this is the first way we can figure out how those kidneys are filtering.